Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to discuss another important vaccine which is known as seasonal vaccine, flu vaccine or the influenza vaccine. Commonly this is known as a flu vaccine because it prevents the flu. So there are various questions about flu vaccine in the parents' mind that we are going to answer today. What is the schedule of the flu vaccine? How many doses are there of the flu vaccine? What are the effects and what are the side effects of the flu vaccine? And one important question now is that whether we got the COVID-19 infection and after that when we should take the flu vaccine, or if we have taken the COVID-19 vaccine, when we can take the flu vaccine. All those queries and the questions we will going to answer today in this video. Friends, influenza vaccine or a flu vaccine. This is standard known as a seasonal vaccine because it is given when the influenza season arrives. In most of the countries, it is September to March is considered as a season for the influenza infections. So what is influenza infections? Influenza infections are basically causing the symptoms like the running nose, high grade fever, cough, and many times in the children, vomiting, breathlessness, all those things. So September to March is the season for the influenza infection. So as a pediatricians, we recommend to give the influenza vaccine prior to the season. So somewhere around August, September, we give this influenza vaccine to the children. Why specifically it is important to give to the children? Because children are more sensitive to get the influenza infections. They have a lot of exposure into the school, nursery, babysitting, so they can catch this infection easily. And the complication of the influenza infection is much more, means that many children develop the high grade fever, faster breathing, sometimes pneumonia, and they may require hospitalizations, and some children may require ICU treatment also. So that's why specifically 6 months to 5 years of the age group, we are strongly recommending to give the influenza vaccine. Now, many times parents says that doctor give the influenza vaccine so he doesn't get the recurrent running nose, cough, cold. So it is not like that because influenza vaccine prevents from the severe type of the influenza, which are H1N1 and H3N2. So the vaccine of the influenza is available is mainly the killed vaccine which we are giving contains the two strain of the influenza A and two strain of the influenza B. The total four strain of the influenza virus infection can be get prevented. So there are various subtypes of the influenza virus. So you will get the protection from these four, but these four are quite serious and they are quite dangerous strain of the influenza virus. So that's why we are giving the vaccine of these four type of the influenza infection. Now, what is the dosage of this vaccine? So this vaccine is basically given into the muscle. It is an injection. In some of the countries, like in the USA, nasal vaccine is also available. This is a live vaccine which is given through the nasal puff. But most of the countries which is available is the injectable vaccine, and this vaccine is given into the muscles. In the children, generally we prefer to give into the thigh muscles so that the pain is also less and the side effects of the vaccine is also less, and it is relatively very safe area to vaccinate the children. Any kind of the muscular injection we can give into the thigh muscles. So that's how the influenza vaccine is given into the children. Now, you might have confusion that many times the doctor advised two dose. Some children it advised one dose. So how it is getting scheduled about two dose and the one dose? So, number one thing is it's based on the age group. So, the children 6 months onwards to the age group of 8 years, if they are taking first time flu vaccine, they have not taken any dose before, then we have to give the two dose of the influenza vaccine. And how these two dose? Two dose with the gap of 1 month in between. So like September one dose, October one dose. So two dose to be given if they are taking first time influenza vaccine. After that, every year there will be a single dose of the influenza vaccine. I strongly recommend to give up to 5 years of the age, because that is the age when they are more vulnerable for the influenza infection, and the severity of the influenza infection is also more. Now, is there any contraindication? The children who should not get the flu vaccine. So there are, in the previously it was uh, the vaccine which was available are contraindicated into the children who has the history of egg allergies. But now, if you have the egg allergy, in those cases also you can give. Now, egg allergies can be of the various severity. Like if the children is getting only the skin rash, then 100% we can give. That is not a problem. But someone has a very severe egg allergy who is getting the blood pressure changes and all those things. In those children also you can give, but with the preparation for any kind of the untoward effect. Suppose child after the vaccination, if the child collapse or maybe his blood pressure goes down, there should be the enough medications available. So we advise those children to give into the hospital setting so that all the resources are available. Now now which are the group of the children to whom it is must? So 6 months to 5 years of the age group, yes, it is considered as a high risk group. Now, the children who has asthma, who has a recurrent wheezing problem, who has any kind of the heart diseases, liver problems, kidney problems, or they are taking any medications which is suppressing their immunity, those children considered as a high risk for the influenza infections. So, those children to be given the influenza vaccine. Now, the next question will be like the COVID-19 and the influenza vaccine. Suppose any person who has acquired the COVID-19 infection, so when he can get the influenza vaccine? So suppose the person has got the COVID-19 infection, he is in the isolation. So as far as isolation is completed and his fever is also subsided, he is otherwise healthy, he doesn't have any symptoms, then immediately he can take the influenza vaccine. But if he has any symptoms, then yes, we advise to delay the vaccine. But for that, definitely you have to consult your healthcare provider who can guide you better. Because most of the COVID-19 isolation criteria and other guidelines are keeps on changing. So whatever is the updated guidelines available at the time, you have to follow. Whether we can give COVID-19 vaccine and the influenza on the same day, same time, yes, you can get the COVID-19 vaccination and the influenza vaccine on the same day, same time can be given. That is not a problem. Now, certain high risk individuals like the pregnant woman and elderly people who are more than 65 years of age, who are suffering from the chronic illnesses like the blood pressure, diabetes, or maybe they are on some kind of the chemotherapies, those also require to take the flu vaccine because it will prevent the severity of the flu infection. So on a broader term, if you will see that almost all the high risk group like the pediatric age group, geriatric means the adult age group who has complications or the chronic illnesses can take the flu vaccine. Regarding the efficacy and the safety, so flu vaccine is there in the market since long, so that is the not a problem. Most of the side effects are the minimal side effects like the some fever, maybe at injection site some pain, some weakness, some patients are feeling like the exactly the influenza, like the symptoms like the running nose, high grade fever, but overall it is well tolerated by the individual. Very rarely, some of the children may develop the illness known as Guillain-Barré syndrome. It is one kind of the disease where you have the kind of the reduced movement of the legs, where you require the hospitalization and some the injections are given to the patients. So overall, flu vaccination is in the highly recommended vaccine to the children, specifically the school-going children. Every year, single dose is definitely recommended. If you have egg allergy, you can take the flu vaccine. And if you have suffered from the COVID-19 also, then also you can take the flu vaccine. Now the flu vaccine which is available is known as a tetravalent flu vaccine. Tetra means four type of the strains. So two strains of the A type and two strains of the B type. So H1N1 and the H3N2. So H1N1 we commonly known as a swine flu. So that two serious strains are getting protected by the influenza vaccine. One important notion about the flu vaccine is that the flu vaccine is getting updated every year. So like if you have taken in the previous year in the September, then this year September, October you have to take till the age you want the protections. So as I told, the high risk groups are considered as up to 5 years of age group. So that age group we definitely recommend to give the flu vaccine. I hope I have answered most of the questions related to the flu vaccine. Still, if you have any questions, queries, doubts, you can put in the comment box, and whenever I will free, I will answer those queries. If you are first time on my YouTube, subscribe as well and spread the video to your friends, relatives, parents so that they can get acknowledged, they can know about the flu vaccine and they get the flu vaccine so that we can assure them that they will get the immunity from the flu vaccine. Thank you very much.